Hi, everybody. Good morning. Hope you're having a great day. Today, we're going to zap the wrinkles away, and we're going to actually, at the same time, take care of some lesions, brown spots, and bumps. And this is actually a very safe treatment that is safe for about 90% of people. So the first thing we're going to do is I've got my device ready. High frequency uses various glass little handpiece heads, electrodes. So this is plugged into an electrical device, wall socket device. And you gently twist until it's pretty locked in. Pull on it to make sure it's locked in. Now, devices like these are sold online. They're called high frequency devices. They are used in, more so in Europe, high-end skin spas. And I'm going to go over the exact thing it really does versus the simple things you'll Google online, which aren't really being explained properly. And I'll talk about that as I go. Okay, so our device is ready to go. We need to prep the skin. Well, obviously right now I have no makeup on and I just came out of the shower, so my hair is not done either. So I'm just going to take some toner. I like this one. And I'm I already took a shower, but it's just another way to just cleanse the skin just to make sure it's ready. Plus, I just love this toner, so any chance I get as an excuse to break out this toner, I will. I've talked about this toner before, so you can probably just see it here. It's the Dickinson's, but it has the hyaluronic acid, rose water, and some other great ingredients. So I'm going to be careful around my eyes, but I'm still going to, okay, and a little on my neck. Okay, so while that's drying and we get ready to start the treatment, if you Google high frequency devices online, you may come across things that say, oh, it oxygenates the skin and no, it doesn't do that. I'm going to explain exactly what it does. But this device, the glass probe, will have, this one has the argon gas in it. But I'm going to tell you why it can treat diabetic ulcers, wounds, brown spots, wrinkles, and bumps. And so it actually has been studied. And again, while my skin is drying, high frequency currents use gas electrodes with air or gas. So neon, argon, or xenon. It's advocated that the electrical field generated by the device and the passing of the current through the body can produce thermal effects, so that's heat production, and the ozone effect due to the sparking produced by the current passing through the electrode. I'll show you the sparking in a second. So when I turn this on, hopefully it'll show up online, I'll show you the gas. This contributes to peripheral vasodilation, so the blood vessels open up. This increases blood flow and oxygen delivery to the tissues. And ozone has been known to treat chronic wounds, like I talked about with diabetes, promotes the healing process. So this can decrease bacterial infections or bacterial counts, fibroplasia activation, and keratinocyte proliferation. It can decrease that, which is a good thing. You know, ozone gas is a powerful antioxidant. Contact with body fluids results in the formation of reactive oxygen molecules and biochemical events. Those events influence cellular metabolism and provide tissue repair and antimicrobial effects. So, right, it repairs the wounds, the scratches, the bumps, and gets rid of the bacteria. Ozone exposure to the skin tissues promotes and activates transcription factor NF-κB, and this regulates inflammatory responses. This also releases platelets from platelet-derived growth factor, known as PDGF, and transforming growth factor. So it's literally helping turn over cells and help improve your skin. This has been studied in clinical use, and the physiological effects have been proven. They did studies on treating cutaneous wounds, and increasing collagen fibers and the number of fibroblasts which heal the skin and the area. So again, this actually works. Now, remember, it's not pushing oxygen into the skin. It's not oxygenating the skin. It is creating the electric spark creates the ozone formation, and then the ozone gas right against the skin is what's causing those reactions we just talked about. Okay, so since we reviewed the science that this is actually a legit device, let's turn it on and get started. So we're going to turn it on. You hear? It makes that sound. Now, can you see, if I go like this, can you see the purple color in there? Maybe if I do it against my shirt. Do you see how now there's ooh, and I can just smell the ozone. Ooh, yeah, potent. Now I'm going to turn this down because if it's way too high, it is not comfortable. So it's very low. You can still hear this humming. And if I touch it, it's like, ooh, it's a little tickle like when you touch an electric blanket that has too much static and you're like, ooh. But sometimes, you touch it and it's literally painful. So you can adjust the settings on the device. So I'm going to put it on a very low setting. When you are doing this, usually I do this on a patient, so I have to put one finger on the patient and then I have one finger on the device. But if I'm doing it to myself, I can't really do that because the charge is just going through me. Anyway, less of a spark when you touch the patient and then put the device down. Oh, that's comfortable. Oh, I immediately smell ozone. Okay, so now I do my entire skin. So I do think that this has kept my skin smooth. If I have an area like right here, I was kind of going after a bump there, I hit it and I sometimes even turn it up a little bit. Oh yeah, I can feel that. Oh yeah, nice little zap there. Oh, and I can really smell the ozone. I think it's a really good idea to keep a window open or a door open because in some people that have COPD or asthma, ozone can actually be very irritating to the lungs. And when it rains and you just smell that fresh rain smell, that's ozone. So again, it's turned up, but I'm okay. Now again, I'm going to hit my Lentigo and hoping that the ozone really activates those platelet growth factors and fibroblast activity. And now I'm going to kind of smooth it over the skin as I go. There's a gentle little reaction. Oh, my skin feels very tingly, and you can see it's getting really pink. Okay, move down here now. Nice little gentle electric feeling. Hit my brown spots. Hit this bump. Sometimes, now that it's turned up, I'll use the tip of this glass probe and force all the energy into one little papule that I have right there that I've really decreased its dome shape size and flattened it out more into almost like a macule instead of a papule. Basically, I'm getting rid of the bump. Look at that. You can literally see it like flattening out as I go. Great. Okay, now back to the smooth spoon side, doing the face. And again, this is a really, see that toner helps it smooth across. This is a really safe device for everyone. So I'm not selling them. I don't make money. But if you go to a facial place that does this, yeah, get it done. Notice how pink I'm getting from the electrical stimulation. Now I'm going to say pregnant women, people with pacemakers, people with cancer should not be using this device. Again, it's an electrical stimulation reaction. And any device that creates that, we always caution that population to not use that. And that's why I said, well, 90% of people are okay to use this. Now, in a second, I will turn it up so you can, oh, it's so loud near the ear. Anyway, super safe to do. I'm not worried about you all going out online and purchasing this. Just be careful because these are glass and I have broken quite a few probes on the floor and the glass is so thin and delicate. It's hard to find the pieces, so I have to be really careful. Again, get every square inch of the face. I don't go over my eyes. No, but I go close to them. Right over the eyebrows. Gonna get my neck. Isn't this fun? And you know what? It's a very, it's a very calming treatment. So high frequency skin device. Okay, so now I'm gonna turn it up just a little bit. The device is getting a little bit warm too. Turn it up a little bit. Woo, yeah, that's good. Because I really am gonna go after a couple of my spots now. Ooh. Yeah, that, I don't know if you can see the reaction if I get up close. Let me see. Ooh. That gives you, that'll wake you up. I gotta turn it down. That'll give you a zap in the morning. I mean, I have a good pain tolerance, but there we go. See, now I don't even have to touch the skin, and it's just reacting right as it gets near it. So, ooh, yeah. Oh yeah, that's like touching a static blanket over and over and over again. I'm going to turn it down just a little bit, but that was to show you on the higher setting that you can really go after something. It's a little bit lower now, so can you see that my face is getting a little flushed? Ooh, yeah. I'm so sensitive around there, which most of us are. We have a lot of nerve endings there. It's very sensitive right there. Okay, I can tell that I'm all done because now it feels very sensitive all over. And that's how I know it's done. And you can see how I'm getting a little flushed from it. Okay, so that's the high frequency device. I go ahead and just because it feels a little warm now and I feel the heat on my skin. Now I'm just going to use my moisturizing toner all over the area just to calm it down. And how quick was that? I'm working today. So for me, that was a little quick do-it-yourself treatment that I do on my patients too. Sometimes I'll dermaplane them first, but it's a really easy way to zap your wrinkles away. I think it's great for brown spots and bumps too. I'm 55 years old. And if you noticed, yeah, I still have some things to work out, but I'm not going down without a fight. Like, I'm going to keep doing this. But anyway, and it's super fun. And I noticed that day, like my skin feels a lot smoother. On the next video I'm going to do here, it's a get ready with me. And hopefully you notice the difference with my skin. But I hope that was helpful for people to tell you really what the high frequency skin device does. And I think it's very, very safe, something to try out. If you do try out, will you leave a comment below and let me know how it went? Or if you have tried it out, what your experience has been. Again, thank you so much for being here. Please like and subscribe, share with your friends. I would love it if you would share my video and we can help more women. Have a great day. See you on the next one.